Welcome to Busia, the vibrant Kenya-Uganda border town, buzzing with trade activities and truck drivers. As COVID-19 infection cases continue to rise, East Africa, home to 177 million people with a combined GDP of $194 billion, is vulnerable to further damage from the pandemic. In response to the impact of COVID-19 on trade, TradeMark East Africa has created a $23 million Safe Trade Emergency Facility, STEF, to support governments to undertake critical measures along transport and trade routes. Funded by our donors, UK Aid, the European Union, Global Affairs Canada, Denmark, Finland, Irish Aid, and the Netherlands, the Safe Trade Facility promotes continuous trade without delays while protecting livelihoods.
I'm called Semakade Hakim, a trucker driver, transporting fuel, basically from Kisumu to Kampala. I've done this job for quite long. This is my 11th year. During this pandemic period of COVID-19, we've got some challenges. For example, before the COVID-19 period, actually I could go for 2 trips every week. But as I talk now, it is 1 trip a week or even less than that.
My name is Praxidis Msundi. I'm a business lady in a market called Kasarani in Busia County. Mainly I'm a greengrocer. Mainly my customers come from Uganda. Some of the products we get from Uganda. Since COVID-19 came, we have a problem. We can't get our products now because the border is locked.
The COVID-19 pandemic has brought about many trading challenges, such as limited availability of personal protective equipment, PPE, at the ports and borders has caused an increase in infections. Lack of infrastructure to introduce paperless customs and immigration processes, and the introduction of compulsory testing for truck drivers has led to long queues at the borders, sometimes 60 kilometers long. Border closure has resulted in a 90% profit drop for informal cross-border traders, who are mostly women. Lastly, the introduction of curfew and limited movements within the different countries has been a huge constraint.
Kwa majina ni Grace Auma Ataro, mimi ni mkazi wa Busia. Nina deal na biashara ambayo ni cereals ambayo unaiona hapa mbele. Biashara hii nimeanza mwaka 2005. Mwanzo wakati tulikuwa tunaanza hii biashara ilikuwa mzuri sana. Tulikuwa tunapata wateja kutoka kaunti mbalimbali wakikuja kununua hapa biashara. Kitambo tulikuwa tunavuka wenyewe, tunaenda Uganda, tukisha pima mzigo yetu, tunapack, tunaweka kwa gari, tuna cross border. Lakini tangia ugonjwa ianze imetukuia ngumu, ambapo sasa hizi tuna connect na watu wa Uganda, na wale watu ni kama brokers ambayo hawana umoja na upendo na sisi kama wafanyabiashara. Vitu kama mali ukihitaji, unapiga simu, unapimiwa, na bei ambayo tunapimiwa nayo sio ile ambayo inafaa tuletewe hapa na tuuze tupate faida kidogo ya kulisha familia zetu.
I'm called Andaman Mansour, a fishmonger. Actually, we have our counterparts from Congo and we do the business with them. And we have seen up and downs so much on the business this time of the COVID-19. The prices, the fees we used to buy cheaply, but this time it's not so cheap.
After assessment of the new guidelines and how they affect trading at the border, TradeMark East Africa, together with its partners, including the East African community, developed measures to help address the crisis. The solutions include procuring and distributing personal protective equipment, PPE, at key borders, developing a driver tracking application to aid the Health Ministry's mutual recognition testing, concept and design of safe trade zones to support informal cross-border traders and supply chain support for resilience, relief, and recovery in essential goods and export.
We need to keep trade going so that people can get the goods they need, the food, the medical equipment, and that basically trade can continue to support jobs.
So what we're trying to do here is number one, we're trying very practically to protect the frontline workers by providing them with PPE, hand sanitisers, keeping them safe while they carry on their customs duties, their immigration duties, or the reinforced health controls taking place at the border. But secondly, we're looking to also make a very practical difference and try and speed up the procedures. You've all witnessed, particularly those of you who live in Busia, the long traffic jams in recent months. At the same time, I think we've been struck by the importance of small-scale trading operations, the kind of classical ladies trading across both sides of the borders, bringing relatively low-value goods, but frequently. One of the things we're looking to do as well is create for them a safe trading space that allows the trade to continue in these COVID times, but in a safe and well-protected environment.
I'm Dr. Boynet, working for the International Organization for Migration, IOM. We're here as part of a team, as well as in Malaba, to assist with the COVID-19 response and the testing of truck drivers. It was important for us to come and assist with the request of the Ministry of Health, because there was an increasing number of truck drivers waiting for a long time for first testing. Because of the long wait, you usually find a long queue of the drivers waiting. So they already know about the testing, they know where to come. And because some of them already have slept overnight in their trucks, they're keen and ready to start. So they come through on my right, and where they actually get asked consent, obviously, because of the testing, and explain the procedure. They also take their temperature and symptoms check. They then move on to get the sample tested. It's a nasopharyngeal test, and the process runs in 24 hours. So if I do it this morning, they get their results by tomorrow morning. And then after we do the test, they move on to what is government portal and health, where they're registered. And this is the same way, the idea is the standardization that's happening. This has had actually a significant impact on the truck drivers, on the waiting time. So here, as well as in Malaba, there is a substantial queue sometimes in waiting, but you can imagine if sometimes a test might have taken a few days, it's a significant impact if it takes 24 hours or a little bit more.
The officials at the one-stop border post work in shifts in order to observe the new guidelines that help curb the spread of COVID-19. PPEs were donated to the Kenya Revenue Authority, KRA, and the Uganda Revenue Authority, URA officials to enable staff to attend to truck drivers safely and speed up the clearance process. With support from TradeMark East Africa, the East African community and its partner states has rolled out an issuance of EAC COVID-19 test certificates through the Regional Electronic Cargo and Driver Tracking System for faster and safe border crossing for cargo truck drivers.
My name is Armstrong Tuliachira. I'm a customer supervisor, URA, Uganda Revenue Authority. I oversee the operations of the one-stop border post in Busia. We do clearance of cargo, persons, and travelers who exit through the one-stop border post. There was a total lockdown after the outbreak of COVID, and so we clear mainly truck drivers and trucks that carry cargo across the borders. So on a daily basis, we almost clear 1,000 trucks. TradeMark East Africa, it is so, I can't express it. It's been there for us. They have given us all the PPEs that we have used. Most of the PPEs that we have used, they have enabled us to operate in difficult circumstances. These PPEs have helped us settle down. They have calmed down staff. They have helped us generally to operate when we are confident that we are safe and secure. And this has also reduced on the timelines for clearance. Whereas we would wait for people to line up one by one, stay distance, we are sure now that we are secure through the safety measures that we're carrying out and through the the PPEs that we have, we are sure that at least we have the protection.
At TradeMark East Africa, we focus on improving the livelihoods of East Africans by implementing effective and efficient interventions. Our vision is to have a united East Africa with flourishing trade, strong investment, and less poverty. TradeMark East Africa, growing prosperity through trade.